Hello, my name is Simone and I'm a counselling psychologist. And today I'd like to talk a little bit about borderline personality disorder. Borderline of what? So we just sort of take that description like it means something. But a psychoanalyst called Adolf Stern is looking at patients who don't fit his map, saying, well, they're not neurotic enough for the couch and they're not psychotic enough for the asylum. So he says, oh, well, they live on a borderline of psychosis and neurosis. But just hear what happened there. The diagnosis wasn't named for the people who were feeling it. It was named for him. It was named for where they sat on his map. And Stern's patients also came with a verdict attached, which is that he said they were unanalyzable, too much for the method. And that's quite a sleight of hand that psychology made and actually continues to make. Because when the treatment fails the patient gets renamed as difficult, manipulative, attention-seeking. The failure of the map becomes a flaw in the patient, right? Because here's the thing about the language of my profession, the psy professions. It's not neutral, never neutral. The psychology professions were born inside a system that bell hooks names quite precisely, it's a mouthful, imperialist, white supremacist, capitalist, patriarchy. And the language, the manuals, the categories, the labels is the language of that apparatus. It's how the system gets into the therapy room. Because to name is to measure, and to measure is to sort, and to sort is to train a body to function the way the system demands it. So a diagnosis doesn't just describe you, it tells everyone who touches your file what you are. So who gets called difficult? Women, overwhelmingly women. In clinics, roughly 3 in every 4 people given this BPD diagnosis are women, while out in the world, the distress is actually spread far more evenly. So there's a gap. And the diagnosis isn't tracking what people feel, it's tracking who gets disordered for feeling it. A little bit like hysteria's mad daughter, the difficult woman, the woman who feels too much, needs too much, won't settle down. And actually, Dr. Jessica Taylor, a brilliant forensic psychologist, researches victim blaming. She's traced this move as, you know, a woman who is abused, who responds to the abuse with fear, rage, mistrust, harm turned in on herself. And the response gets renamed a disorder of her personality. And the abuse then vanishes from the story. Her personality goes on trial. And the best predictor of this diagnosis isn't in fact a broken brain, it's trauma. It's relational, early, often at home, which brings me to attachment, disorganised attachment, which is what happens when the person who's supposed to be your safe place is also the source of your harm, your fear. And a child can't solve that. So the attachment system says, like, go toward, but the threat system says, get away from the same person and from the same moment. It's total confusion. And for so many people carrying this label, the people who hurt them, they were family, the very arms that should have held them. So the psyche does something pretty amazing, actually. It learns to reach and brace at once, to cling and push away, to love and fear in the same gesture, which is not a disorder or a malfunction. That's a totally logical conclusion of an impossible situation. So psychiatrically, the strategy makes perfect sense. It's the situation that didn't. So what does that look like years later in love? Okay, it can look like arriving in love with an alarm attached. It's like closeness is what the whole system yearns for, but closeness is exactly what the whole system learned to fear. So it isn't actually conflict that often triggers it, it's actually intimacy. The better love gets, the more there is to lose, and the body remembers what losing felt like. So this can look like scanning, reading a face, a tone, a text for the first sign of leaving. A delayed reply isn't just a delayed reply, it's like evidence. It's not paranoia, that's just the nervous system that was once like scanning to read a parent's mood before the danger arrived, still doing its job brilliantly, just in like the wrong decade. It can look like testing, so that's like picking a fight before the abandonment can happen. It can look like being the one to leave first, being the one to hurt first, which from the outside can look like total sabotage, but from the inside, it's the only safety on offer. Saying like, I cannot survive being left, so I'm not going to be caught waiting for it. And for the person on the other side, it can feel like whiplash, very confusing, being pulled very close and then being pushed away, sometimes in one evening. You know that phrase, like walking on eggshells? Notice what that does. It's like one disordered person and one long-suffering person. But that is the diagnosis talking again, because relationally, it's more like both nervous systems are in the room. And the pattern lives between two people. So even when one person's history is doing more of the driving, there's two people in it, right? But then the rupture passes. And this is really important to include, is the aftermath, the guilt and the shame that arrives like a real verdict, watching yourself hurt the person you most love, often knowing that even as it's happening, you really don't want it to, and then you hate yourself afterwards with a violence you'd never turn on anyone else, which is the self-harm piece, right? Because people with this presentation don't lack awareness of damage, they drown in it, and they often try to reach back clumsily, desperately, sometimes, but they do reach back. They go, please tell me I haven't ruined this. And that remorse really matters because it separates two very different strategies under relational distress that can look quite similar. One hurts you in its panic and then grieves it, reaches for repair, takes on the blame, usually far too much. The other, which is narcissism, protects itself from shame by throwing it outward. So there's less reflection, less remorse, no reaching back. One is flooded with accountability. The other can't afford any accountability. So if you're trying to make sense of a painful relationship, don't ask whether someone struggles. Ask what happens after the rupture. Ask yourself who reaches back. So let's revisit borderline. The borderline is never inside you. The border is the line the map drew around what couldn't be explained. She's never on the edge of two disorders. She's on the edge of being believed. And I think that's really important to name, especially in this culture. Okay. Take care. Bye.